The issue that I want our new president and Congress to work on is healthcare. I believe healthcare is a human right that all developed nations should have. We're one of the few first world countries that don't have universal or free healthcare. Having universal or free healthcare can help with a number of problems like poverty and the ongoing coronavirus pandemic. The average cost of an ICU patient is around $1,107 a day. Coronavirus patients who are hospitalized in the ICU stay for 3 to 4 days. This can devastate a person's bank account, causing them to go bankrupt. According to CNBC, 65.5% of people who filed for bankruptcy said that medical costs was the main or one of the main reasons for their filing. Some people have medical bills up to $1.9 million due to coronavirus, according to the Wall Street Journal. Without health insurance, this will cause everyone, except the top 1%, to go bankrupt. On average, the United States spends double the amount on pharmaceutical drugs than other prosperous countries. People in Germany and other countries are paying half of what I would pay in the United States for the same medicine. According to Investopedia.com, in the United States, hospital workers are paid more than workers in other countries. For example, nurses in the United States get paid an average of $74,000 a year, while nurses in Switzerland get paid an average of $58,000 a year. The higher salary of hospital workers can cause you to pay more for the same care. Most U.S. hospitals are for-profit centers, making them charge exorbitant prices for care. An operation to open a blood vessel can cost you around $6,000 in the Netherlands. The same operation in the United States can cost around $32,000. The United States also spends much more on preventive lab tests. A CT scan in Canada will cost you around $97. In the United States, it will run you around $896. MRI scan in the United States also costs much more, at $1,400 in America. But in the United Kingdom, it will run you around somewhere around $450. In the United States, we pay much more for care, so surely it's the best in the world. No, according to Numbeo's Healthcare Index, the United States is ranked 30th, below countries like Turkey, Mexico, Ecuador, and Sri Lanka. Personally, my people and my family have to pay high prices just to not feel excruciating pain. My grandfather has Crohn's disease, so the prices he has to feel not to pay horrible pain is terrible. He has to take mesalamine, and in the U.S. it costs him around $1,800 before insurance, just for 90 days of medicine. In Canada, it would only cost him $208. Luckily, he has insurance, but it doesn't do enough. It still costs him $600, which is still 3 times the price than in Canada. So yes, this is what I want President Biden and our new Congress to work on. Healthcare. If we want to keep calling ourselves the best in the world, we need to act like it. Our healthcare system is built like a third world country, but we have the highest GDP in the world. We need to act like it, and we need to use that money to make sure our citizens are safe and healthy.